was flying a police helicopter years ago, and I was in a crash, a mechanical failure. At a bad time, I was injured pretty badly, as was the other officer I was with, and it caused a great deal of back problems over the years because we crashed going straight down. We didn't run into something straight, we hit going straight down, which did a lot of damage to our backs, and it progressively got worse over the years. And I lived in a lot of pain for a lot of years. Sometimes it would get down to where it's bearable, but it was just something you thought about every minute of every day. And it got to the point where I finally had to deal with it because it was just ruining my life. I couldn't do anything day to day, and the pain was too much. So I happened to see a doctor down here in Rancho Mirage, and turns out he was a Navy flight surgeon, and which is good because I was a Marine Corps pilot also. And this doctor said, you know what, I think you're probably going to need surgery, and I know just the guy for you to see because he operated on me too. And I said, really? Well, that gives me a little bit of confidence. And I'd always heard stories about how bad back surgeries go and how they're not successful or they don't really help much. So I really put it off for a lot of years just for that reason. I went to see Dr. Limonadi over at the Eisenhower medical area, and he looked at my MRIs, and this was on a Friday, and it's very strange how it all happened, but it was on a Friday, and he said I was definitely going to need surgery after looking at my back, and said, however, if you have any problems between now and the month that we have to do it, he said we can't put it off too long. And I agreed because I was in misery. So it just so happened on that Sunday, everything finally came to a head. I woke up, and they always ask if your pain's 0 to 10. I have a high pain threshold, but it was way over a 10. And absolute agony. Plus, I was paralyzed in my left leg, and my right leg was going fast or I couldn't move in it. So my wife took me down to Eisenhower Medical Center, and luckily, because of the trip on Friday, they already had all the MRIs and everything they needed. And Dr. Limonadi came in and took a look at me, and he told me with a smile, and I found it kind of ironic. He said, because doctors have to say this, well, we don't have to do this. I said, no, I think we're to the point we really have to do this because I'm not going to live like this and I'm paralyzed. And I said, you just do your best. I said, whatever you can do, go for it. And he operated on me. Took a lot longer than they thought it was going to. But I woke up and I remember thinking it was the first, I could feel my legs, could wiggle my toes. And other than the surgery where it hurt just from the cutting into me, it was the first time in years I wasn't in any pain. And that was absolutely a miracle to me because I never expected to get back to where I was going to be pain-free again. So it's just good circumstances and good fortune that after all the years that I ended up having to go down to see Dr. Limonadi, because the guy is a very gifted surgeon, a very smart guy, and I felt very comfortable having him work on me. Today, the best thing I can say about my back is I don't think about it. That's how you know you're doing well, because if you don't have to think about something, it's not an issue. And my back has been so good since he operated on it. I could never have hoped for anything better. It's great. I don't have to think about it. And I can move, I can do things I never did for a lot of years. And sometimes when I do those kind of things, like bend over, pick up things, get down on my knees to pet the dogs, anything like that, I don't have to think about it. And I couldn't do those kind of things before. And so it's great. I do all kinds of things today that I couldn't do before. And whenever I do them, I think about the fact that I couldn't do this not that long ago, such as pet the dogs, bend down to weed, bend over to get something I dropped. Anything like that that requires movement in your back, I couldn't do that before, and now I can. And I think about that when I'm doing it, that this is a huge improvement, that I've gotten to the point now where I can actually move and I have no pain, and it's amazing.